All right. How are you feeling today?
Hey guys, I'm Rishi Desai. I'm the Chief Medical Officer at Osmosis, and I want to talk to you a little bit about how I think you can be effective at helping patients with a rare condition or disorder. And in my life, I've come to realize that there are a few things that I've stumbled upon and kind of figured out that have helped, and I want to share those things with you today. So the first one is being humble, or be humble. And the reason that this is so important is that, there's this trajectory where you go to medical school and residency and fellowship and you get all this information in your head, and then you go and practice medicine for, let's say, 5, 10 years or longer, and you've got decades of medical knowledge in your head, and it's very tempting to think, oh, I know a lot, I know it all. And the truth is, as much as you know, there's a lot more that you don't know, right? And so as patients come in with rare conditions, odds are that you don't know what they have right off the top of your head because they're rare. Any one condition is rare, and there's a lot of information about every condition, so it's very unusual for someone to know a lot about everything. So there's a good chance you don't know what they have. And up front, just being honest about that and saying, look, I don't know what you have. These symptoms you have, I'm not sure what pattern that's following or what that condition could be. I don't know. But I'm willing to work with you to figure it out. And I'm going to stick this out with you. I'm going to be your ally. Patients really don't expect their doctors to know it all. I think that's a myth. I think what they do expect from their physicians is that they're going to be there by their side. And so just saying that, being honest about that is very important. And to do that requires a bit of vulnerability. As physicians, we're often taught not to admit that you don't know something or kind of build up this aura of perfection. And really saying, no, that's not quite right. I think that the more important thing is to display some vulnerability, but also steadfastness and saying, look, I'm going to be with you as we figure this process out. And I think that's really what a lot of patients want to hear and want from their physicians. So that's the first point. The second point about being humble is there's actually this cognitive bias that we have. We think common things are common, and so you're kind of biased to always assume that even if something doesn't quite fit, it's probably the thing that you usually see. And the downside to that bias is that you're going to make mistakes. You're going to have situations where you keep thinking that someone has a common condition and actually they have something that's quite rare, and you're really not being very careful about that. You're not doing your due diligence to track those other options down. So getting tests and confirming your diagnosis, sometimes people don't do that. So that's the other piece, is that you want to make sure you avoid making mistakes just because you're blinded to the idea of things being outside of your normal, everyday, common practice. So again, being humble about what you know. Number 2, the second big idea is help however you can. So, I'll give the analogy of an automated phone system. You often, I'm sure everyone has had this experience, you kind of call in and you get bounced around, and by the time you're on your 4th or 5th person that you're speaking to about a problem, you're very frustrated. You spent 45 minutes, maybe 50 minutes on the phone, and your problem still hasn't been resolved. And so patients with rare conditions often are coming to the medical system like that. They've been bounced around, they've seen lots of different clinicians who have told them different conflicting things, and now they're seeing you, and you may be their 4th or 5th person that they're seeing. And the first thing that you can do in terms of helping however you can, it's very helpful to empathize with that and saying, hey, I recognize, I'm looking at your chart, I've seen that you've seen lots of people. That can be really frustrating, and I'm sorry if you've had the experience of hearing conflicting information. What we're going to do today is try to go through all the things you've heard and sort out kind of fact from fiction and make a concrete plan as to what the next steps are going to be. So just empathizing is a good first step in helping however you can. The next thing is taking responsibility and saying, look, the buck stops with me. I'm going to take responsibility for you. We're on a journey together. We're going to figure this out. I may not be the one that has all the answers, and certainly I don't expect every clinician to just have the answer for a rare condition, but it is important to take responsibility. And so, for example, in my own life, I've had individuals come to me, and I'll send them out for another consult. But then the key is I follow up with them and say, hey, let's check in again in a few weeks and we'll see what happened. If that consult was helpful, great, thumbs up. If it wasn't, then we're going to figure out what the next step is going to be together. So you're not out in the cold. Oftentimes it can feel like, patients can feel like they're out on the street on a rainy day, and all the doors are being slammed in their face, and they have no real medical home, nowhere to go to feel like they're actually accepted and that someone's going to kind of follow them on this journey. So just taking responsibility is really important. And kind of part and parcel with that is advocating. So you may not have the exact diagnosis, you may not know exactly what to do, but you can certainly advocate. And this goes across domains. So you can advocate maybe with their school and say, hey, look, this young patient is missing school. Let's figure out a plan for them. Or you can advocate maybe with a hospital and say, look, let's get a consult service to take care of them and bring them inpatient to figure this out more quickly. Or you can advocate maybe with in some cases, pharmaceutical company or regulatory agency and say, look, there's an off-label medication we'd like to use, but we've got to fill out this paperwork to make it happen. You can be an advocate by doing those things. So there are lots of ways you can help however you can without having the final answer of what their diagnosis is. There's lots of other stuff that a lot of physicians can do because they're physicians. A lot of doors will open for you that won't open for a patient or a family. And a third is this idea of getting expertise. I can't stress this enough. The idea is not that you just have all the answers, right? The idea is that you do whatever you can. You roll up your sleeves and you go find the answers, find the experts that might be able to help you out. And with rare conditions, a lot of the information is in experts. You know, oftentimes there is not a lot of kind of published data on a condition, and you really have to just call up people and say, hey, you see a lot of patients with this condition. What do you suggest we do? Or better yet, maybe you can just take over the care and I can be a secondary player in the team. So finding that key expert, and it can be a physician expert. Sometimes, I've had to find experts at other institutions, even other countries, calling other countries, experts in other countries and saying, look, this is a pretty rare condition, but I've seen that you've, seen patients with this. I'd love to get your help on this. The other group of experts and a couple other groups. One is foundations. A lot of foundations exist for more rare conditions or disorders. So reaching out to those foundations, there are a lot of individual foundations. There are kind of umbrella foundations. For example, the National Organization for Rare Disorders, NORD, is kind of an umbrella foundation. They can kind of put you in touch with other smaller foundations. So reaching out to foundations and saying, hey, we have this condition now. Maybe once you get the diagnosis, let us get some help. Put us in touch with the right clinical team and maybe even other families. And that's the third kind of group of experts are families. Individuals with the condition, their families are often very, very plugged into exactly what you need to do to take care of your condition. So that's the other place that I would go to say, hey, we need help with this. Keeping in mind, families are the ones that are most affected by these rare disorders. They're the most invested in trying to figure out solutions for them. So reaching out and getting information and expertise from families is very, very helpful. So I want to also now kind of tie this together with a quick story. I had in my clinic a few years back, a young boy had fevers, muscle aches, weight loss, rashes, and he was kind of going, initially he was in school and playing sports, but very quickly he was missing school. He couldn't go in because he was fatigued. So this is a very life-changing event for this young man. And it happened over the course of a few months. And so his family came to see us in my clinic. And I say us, my team. And they drove 4 hours to come and see me. And 4 hours back. So that's an 8-hour round trip. And they did it over 2 days. So they're missing some work. He's missing school, as I mentioned already. So it's a big event to come and see me for that short clinic visit. So there's a lot of expectation that it's going to be valuable for them, right? They're setting aside 2 days to do it. And, they came into the office and I went through the chart. They'd already seen, genetics, metabolism. They were seeing me, infectious diseases. They'd already also seen GI, rheumatology, oncology. So a lot of other services had been involved. And when they saw me, the first thing they said is, look, we really want a second opinion from one of these other consult services. It's in another state, and we'd like to reach out to them. And so I said, okay, great, let's get them on the phone. And so they couldn't get into that clinic because there were a number of kind of blockers, let's say, for families. But because I was a clinician, I was able to kind of get right through. So in that clinic visit, I picked up the phone, we called the clinic, I spoke to the clinician on the other end and said, hey, this is the story. Can you see this patient, or do you think this is interesting to you? Maybe it's this condition that you're kind of a specialist in. And they were excited. They were like, oh, absolutely. We'd love to see this family. It sounds like one of our cases. Please have them make an appointment, and we'll see them right away. So it was great. You know, they were able to see that clinician. That clinician had expertise that I certainly didn't have. And we took care of that in that clinic visit. We followed up afterwards, and indeed, they ended up having that diagnosis. And so it worked out for them that they got a diagnosis, they figured out what they needed to do, and it ended very well. For me, you know, I actually looked it up online, and I wanted to see kind of more about it. Again, there wasn't much information. So really, we're relying heavily on the clinical expertise of the consult that we reached out to. So this is just a quick story that kind of summarized some of these points, because I obviously had to be very humble right away and say, look, I don't know what you have. This is interesting, but let's figure this out. In terms of helping however I could, we made the phone call, and getting expertise was what ultimately helped this family. So this kind of summarized all three of those points, but in other situations, it's been two or one of those points, and it happens more frequently than I would have guessed early on in my career. So anyway, I hope that was helpful. It certainly has been a pleasure taking care of families with rare conditions and disorders. I certainly learned a lot from that, and I hope you found this useful in your own clinical journey. Take care.
Start your free trial today at osmosis.org.